Righty. Hello. Thank you so much for joining us for our educational webinar, Getting Your Feet Beach Ready. Tonight's speaker is Dr. Ralph Napolitano, podiatrist and wound care specialist at OrthoNeuro. Dr. Napolitano is a double board certified podiatrist and wound care specialist physician. He specializes in medicine, surgery, and wound care of the foot, ankle, and lower leg. He was the first podiatrist in the state of Ohio to earn the board certification, certified wound specialist physician. Dr. Napolitano will answer questions following his presentation. Please type your questions into the Q&A below at the bottom of your screen. Dr. Napolitano?
Aloha, everyone. I'd love to tell you I'm meeting with you from a tropical paradise, but I am coming at you live from Columbus, Ohio. And those of us that are Central Ohioans know that spring weather can be a little funny. Indeed, we're experiencing that this year. Also, apologies for the video quality. We're not exactly sure. See, I could have lied and said I was coming to you from a tropical paradise, hence the problem with the feed. But we'll do the best we can. At least you can hear me and you can see our screen. So I appreciate that introduction. So today we're going to kind of go through things we can do for our feet and lower extremities immediately to get them ready for vacation, for the beach, sandal season, etc. A little bit about our lower limb, the foot. It's an amazing amount of biological machinery. Okay, we produce a half a pint of perspiration daily from our sweat glands. The average person will take enough steps to walk the earth 4 times. Okay, so that's pretty amazing what these feet do for us. And I think we take for granted our feet, and we certainly need to take care of them. Regarding the foot's anatomy, there's some unique things with the lower extremity. The skin is unique regarding the microbiology. You figure where our feet live, our shoes, and that whole microbiology is a little different compared to other body parts. From a circulation standpoint, our circulation is relatively compromised, even for folks that have good circulation. You figure your foot and toes are the farthest things from the heart. So those vessels need to travel a long way from the heart to get to our toes and our feet. Also, we look at, well, what are they doing? Well, they're supporting the body, all of these ground reactive forces, how our mechanics works. There's a lot going on with our feet. Okay. So getting to the matters at hand, one of the very common problems we see in podiatry is onychomycosis, all right? This is a nail fungus infection, all right? About half of Americans will be diagnosed with this by the time they're 70. Risk factors include age, genetics, etc. Just being a guy predisposes you to this, environmental exposure, and some other things. So our skin, the largest organ in the body, this is our first line of defense. And folks that are immunocompromised or have problems with their skin, certainly our nails are an appendage of our skin, and this can predispose to this fungus infection, all right? These dermatophytes, which are these microscopic plants that are the fungus that causes onychomycosis, these are the most common pathogens, okay? We diagnose this clinically, so with tests, a sample of toenail, we send to a lab and we see what's going on there. So we probably, for better or for worse, know exactly what this looks like. The nail is thickened, it can be deformed, it's yellowed, it can be even brown, okay, lots of different changes. There can even be odor. Of special concern, certainly folks with diabetes, circulatory issues as referenced, and immunocompromised folks, it can be further at risk. So left untreated, this can cause permanent damage to the toenail, okay? Also, no one likes how this looks. So if we're talking about showing our feet on the beach, this is certainly a talking point of concern. And this is what this looks like. You have a milder case where you have some distal yellowing of that toenail to more moderate, severe cases where that toenail is very thick and discolored there. It can even cause changes where the toenail can ingrow, which is another problem that we'll discuss. Okay, so this is what this is. Very common, unsightly, and no doubt beyond just a cosmetic problem, but a true medical problem. All right, so what do we do this? Well, how do we get it? You figure it's an infection, like a bacteria, but this is a fungus. We have oral antifungal agents, okay? We also have topicals. Now, topicals over the years have improved significantly, and we've gotten a lot better about what they can do. At OrthoNeuro, we have laser, and laser technology is heat and light energy to take care of different medical problems. So with all of that said, a lot of times we do a combination of these therapies, either topical laser, some laser, etc. All right, so again, laser is heat and light energy to take care of various medical problems. And in this case, we were talking about fungus problems. This is fungicidal, okay? So the healthy tissue is spared utilizing our laser, and the nail plate, which is that thickened toenail itself, is not removed, all right? We don't create any wounds. It is a little bit warm, so patients experience a little bit of discomfort, but no anesthesia is required. It's a simple office treatment. It takes a few minutes. We do this serially, meaning over a course of several months as that toenail grows. Now, regarding growth pattern, toenails grow a millimeter or 2 a month, so it takes a while for this to get better. So if this is a problem you've been dealing with, it's good to get on it sooner than later. Also note, as we move along with our discussion, our laser is FDA cleared not only to treat nail fungus, but to treat inner warts, skin warts in general, as painful and unsightly scars. Okay, so this is a before and after little pictorial about or showing nail fungus responding to laser. Okay, so we can see how the yellowing improves and how that thickening of that nail plate gets better. And as referenced, combination therapy is very effective, where we do either a topical with an oral, laser and a topical, laser and oral, etc. A lot of patients choose the laser with the topical. I will reference that there is literature to support some side effects with oral antifungal therapy, namely liver issues. Now, these problems are fairly benign and self-limiting and uncommon, but they can occur. An analogy of a similar side effect are folks that are on cholesterol medication. Those, pardon me, those medicines can affect the liver, but of course, your cardiovascular system is quite important. So that's where certainly we need to hedge what's important. So with all of that said, again, as referenced, a lot of patients choose laser with topical because there's essentially no side effects whatsoever with the topical and laser therapy. Now, if we're talking about cosmetic things and having nice feet for the beach and vacation, we also offer something for deformed nails called Cariflex nail restoration. So we're all familiar with the aesthetic field and manicures and pedicures. We offer a pretty unique thing at OrthoNeuro, in which we build a synthetic nail out of a liquid polymer. So unlike a press-on synthetic nail, if you will, this is actually a liquid that we form into a nail that lasts 4 to 6 weeks. Okay, it's completely for cosmetic purposes only. It's not a medical cure at all, but takes care of unsightly toenail problems. Okay, so this is utilized for toenail fungus, nails that are deformed because of trauma, brittle nails, nails that are discolored. This is what this looks like. You can paint over this, so it's really hard to tell. You have this done. You can utilize nail polish without any problem whatsoever, and it's just a good solution regarding cosmetic issues with toenails. All right, so that's toenail fungus. Moving on to athlete's foot. Scientific name of this is called Tendinitis. Pardon me. I think our spring weather and allergies has affected me a little bit too. So maybe I can get some time away as well and hit that beach vacation. Anyway, this condition, other than being unsightly, is a medical condition. We're familiar what this looks like, how it feels, scaling and peeling of the skin, itching, etc. Blisters can even occur. Advanced cases of athlete's foot, which is caused by a fungus, can result in a bacterial infection as well as a fungal infection. This can spread to the toenails and vice versa. So athlete's foot and toenail fungus are related and can potentiate each problem together. Also of concern regarding this problem are folks with diabetes, circulatory issues, immune problems, etc. All of those things can put patients at risk for more severe cases of athlete's foot. Okay, so we see this between the toes, on the bottom of the foot. Okay, we get the scaling, the peeling, can even cause breaks in the skin, an ulcerative form. This is what this is. Okay, dry, flaky feet, unsightly. And since it is an infection, we have antimicrobials, anti-infectives to help aid with getting this condition better. So we can do oral medication. Typically, these are shorter courses compared to toenail fungus courses for toenail fungus, if you will, using antifungals orally. Creams and ointments are often mainstays, combined with the steroid. Something I like to tell patients is not only do we talk about foot health at OrthoNeuro, we talk about shoe and sock health. So doing things with our shoes to prevent recurrence. All right, it's important to take care of our shoes, keeping those as sanitary as possible. Regarding our socks, while laundering them in a bleach or bleach alternative, common sense hygiene things go a long way. Also, if you look at where there's a lot of feet that tend to be around each other, places like gym shower floors are certainly a place where these things can be spread a little bit more easily. Now, of course, we have an immune system, and that helps stave off some of these issues. But again, those folks that are immunocompromised or have diabetes that's not well controlled, you're at risk for these problems to get worse. Okay, so that's our fungal infections, two very common things we see, toenail fungus and athlete's foot. Moving on to ingrown toenails that can be unsightly and certainly painful. So this is a condition in which the toenail curves into the soft tissues surrounding that toenail, causing pain and infection. The nail may even puncture the skin, as referenced. These can be a genetic thing. They can be related to trauma, etc. So here's a little bit of toenail anatomy, all right? You have those inside and outsides of the toenail, or as we say, medial or lateral. These are the areas that tend to ingrow, especially on the big toenail, okay? Most often we see these on the big toenail, but lesser toenails can be affected as well. Sometimes the toenail can ingrow at the distal portion of the toe, but more commonly we see them on the inside or outside borders. And this is what this looks like. These can go on for months too. I've had patients that have had these for several years. Certainly an uncomfortable, unsightly condition. So treatment and prevention of these, we remove the offending nail border either temporarily or permanently. We'll get into that in a little bit, depending on the severity. Antibiotics and taking care of these with soaking, antibiotic ointments and creams, etc. Now, when we trim our own toenails, we want to avoid excessive rounding. We want to trim them more straight across because when we excessively round our toenails, that predisposes them to grow into the sides, either in the front of the toenail or on the what we call medial or lateral border of the sides. Tight-fitting shoes can be problematic as well. So avoiding tight-fitting shoes with pointed toe boxes over extended periods of time are certainly ways to avoid this. Sometimes, regardless of what we do, there's a genetic predisposition, and the toenail just simply ingrows, and there's not much we can do about it other than having medical care. is a little procedure that shows this. This is a very simple, common office procedure that healthcare providers do. As podiatrists, we do lots and lots of these, okay, both on younger folks, kids, and adults alike. Think about a dental procedure, except it's your toe, of course. It's done under local. We numb the toe. We remove that offending nail border. Okay, so the pictures at the bottom show that. Now, once that's removed, we can use a medicine to kill that root so it doesn't ingrow. The success rate of that's significant. So when we do this, about 95% of the time we're done. Now, one might ask, why would you do this temporarily? Well, the recovery for a temporary procedure is quicker than one that involves killing the root of the nail on the side. So if this is kind of a one-off problem, if someone's trimming their toenail incorrectly, just want to get rid of this temporarily and see how things go, then that's a situation where we can do a temporary procedure. Okay, so this is a before and after surgery. Recovery, not very long at all. You're uncomfortable for a couple of days. Over-the-counter pain medications, all that's necessary. Regarding your line of work, if you do somewhat of a labor-intensive type job, that would be a little bit of time off, maybe a couple of days, but you're back in normal shoe gear in a couple of days, and we don't really know this was done after a couple of weeks. Okay, another skin condition are plantar warts, and what these are benign viral infections, okay, affecting the skin and resulting in these like cauliflower lumpy-like changes, all right? They can hurt, especially if they're on the bottom of the foot, a weight-bearing surface. They can grow and propagate. A lot of times they'll go away, but they take some 2 ways. Before they resolve, they multiply in number and, of course, cause a significant, unsightly, uncomfortable what these look like. Again, these are spread similarly. Athlete's foot spreads via contact transmission. Plantar warts also can spread from family member to family member. So folks have this at home. It's important to sanitize your shower in between uses and avoid sharing shoes and socks, common sense hygiene type things. Okay, so how do we get rid of these? Well, topical medicines can be effective. Over-the-counter acid therapies can be effective, but I'll cite some caution here. Folks that have circulatory problems or that are diabetic with poor control, those over-the-counter acids can cause more harm than benefits. So we have to use those judiciously because acid is certainly a caustic agent that can cause a chemical burn. Now we get rid of the wart, but we also can burn the surrounding tissue, and that can result in a wound, a wound that's potentially more problematic than the treatment itself. Okay, laser, again, I referenced that earlier. This is a minor office procedure. Now, this is a little bit more uncomfortable, and as such, we either use ice therapy in between laser pulses, or we numb the area in the office when we do this. You can even do a traditional excision type of procedure, which results in a little open sore that takes time to heal. But in our practice, typically the laser carries the day and has supplanted a true surgical incision or excision technique. Okay, so corns and calluses, these are thickened skin lesions on the foot and toes resulting from shoe gear, foot deformities, or how a person walks. These can become painful when they get thick, and it's really the body's own response to preventing an open sore on that toe or on the bottom of the foot. Okay, and that's what these look like. Okay, we say a corn is on the top of the toe, a callus is on the bottom of the foot. Calluses tend to be a little bit more spread out, whereas corns tend to be more focal, if you will. So those pair of shoes that rub one particular toe, that's, again, the body's way to protect itself so you don't wind up with an open sore. Okay, now how do we treat these? Well, keeping that thickened skin smoothed down, all right? Removing the offending shoe gear, all right? Switching shoes around, not wearing the same pair of shoes day in, day out. If you have some biomechanical issues, a shoe insert that we call an orthotic helps with correcting a person's gait, all right? Or certainly there's surgical options. Now, when I started our talk today, if one is going to have foot surgery, that's not an overnight fix, and foot surgery typically takes a few weeks to get better. So if you're planning a vacation, certainly I'd allow 3 months for recovery from foot surgery as a general recommendation. Palliative foot care, our first bullet point here, this is something we do. Folks that have difficulty caring for their own feet, that have health problems or mobility issues, this is something that insurance covers, where they come in and think of maybe a medic, trim toenails, we smooth down corns and calluses. This can be done every couple of months where insurance pays for this. If folks want this service sooner at the hands of a medical professional, there would be a small cost if you're coming in a couple weeks versus every 2 months, which is our Medicare for this service. Okay, so if we look at why we get corns and calluses, we can see right here foot deformities. Okay, bunions and hammer toes, common terms. A bunion is a malalignment of the great toe joint, which that metatarsal, which is part of the articulation of what we call a metatarsal phalangeal joint, where a toe moves at the joint, the ball of the foot joint there, where that metatarsal either goes in, depending on how you want to look at it, or east or west, depending, causing the to go out. So that picture in the center shows what a bunion looks like. If this progresses and goes on, then you could even have an overlapping or underlapping second or third toe. Those pictures that you see there. Now, hammer toes are where a toe rises above what we call the transverse plane, and you have your toe that essentially sticks up and puts pressure on the toe and shoe gear. Okay, here's some x-rays of what this looks like. In fact, the x-ray on the right is a very severe case where that second toe is even dislocated. All right, why we get these: genetics and heredity, some trauma, shoe gear, work habits, etc. All these things cause an imbalance in tendons and ligaments, which result in things being overpowered. So a tendon that helps move the toe up sometimes is overpowered by one that moves it down, etc. And that causes these deformities. Okay. Now, how do we treat these? Well, simple things: shoe gear and activity modification prevent things from getting worse. Padding options, right? Corn pads. Now, I don't universally recommend medicated pads, as referenced earlier when we talked about plantar warts. Those acids can be problematic for patients that have diabetes or circulatory issues because they can create open sores, even though the thickened skin gets reduced utilizing those acids. Again, the cure in some cases is worse than the problem. Palliative care, as referenced, reducing that thickened skin. For inflamed bunions and hammer toes, anti-inflammatories, pain creams, etc., where we have some arthritis that has set in, and of course, surgery. Okay, here's some non-medicated options for bunions and hammer toes. All right, so how do we prevent these things? Well, appropriate shoe gear. One thing I do for our group, I write a blog called The Step Ahead, and I reference choosing shoes in a couple of my blogs. So I point you in that direction. We can get into talking about shoes, certainly in a whole other webinar, but right shoes, the right size and of good quality are certainly important. As referenced earlier, avoiding narrow toe boxes for any length, excessively high heels. For ladies, that can be problematic. Arch supports can prevent the progression of these problems, but can't put them back. And as referenced, sometimes genetics, we can't outmaneuver. So even though we do the best we can to prevent these problems, they occur regardless. Okay, little surgical pictorial. There's about 100 different ways to fix a bunion. You have to remove the bump and reposition the bone. There's some complexities that need to happen when we do foot surgery. We have to align the bones, we have to correct the biomechanics, and sometimes hardware is external. These are hammer toe pins. After surgery, we call this skeletal traction, where that positions that toe for a few weeks, and then that pin comes out. And of course, we have internal fixation, plates and screws and different implants to hold the corrected position of the toes after surgery. Okay, and I think this is our last topic, all right, tendinitis, which is an inflammation or irritation of a tendon resulting in pain, possibly weakness, some instability, some gait problems. If the tendon sheath is involved, which is the coating around a tendon, it's called tenosynovitis. So this is often a result of overuse or a traumatic event or biomechanics. The foot, again, is a very complicated body part, and everything has to work in alignment. If we have something that's a little bit off, that can pull in an abnormal direction. If we remember physics in high school, or maybe some of us are taking physics now, if we remember vectors, they have a force and direction. And if something is off a little bit, that can cause certainly biomechanical imbalance and inflammation and pain over time and tendon damage. So as referenced earlier, that average person walks the earth 4 times. So you figure how many steps we take in a day, a week, a month, that's a lot. So if something is out of balance, that can certainly result in these problems. So in the foot, most common tendons that are involved are the Achilles tendon, which is the strongest tendon body that helps propel our foot forward, as well as the posterior tibial tendon. That's a tendon that helps form our arch. Okay, a little bit of anatomy here. The back of the heel, that shows that Achilles tendon. The posterior tibial tendon, that's that strong tendon in the medial portion of the foot, and the arch that helps make that arch. Now, at the bottom, there's something called the plantar fascia, which we'll touch on too here as part of this little section. That's a subset of tendinitis. So prevention and treatment, of course, it's an inflammation. So anti-inflammatories and or steroids, sometimes injections. Typically, physicians, healthcare providers don't inject the Achilles tendon because that can be an area that can weaken, especially if it's damaged, and injections sometimes can cause things to further weaken short term. So steroid injections typically are not done. Sugar and activity modification are also mainstays, controlling that abnormal biomechanical insult, and possibly orthotics, again, which is that shoe insert either over the counter or something custom made to help control those biomechanics. If things progress where we have a severely damaged tendon, or we need to rebalance how things work in the foot, then there's surgery to repair the damaged tendon or tendons, as well as to control those biomechanical forces. Okay, so our subset of tendinitis is plantar fasciitis. Very, very common, okay? This is an inflammation of that plantar fascia ligament, which stems from the heel and flows out in the toes. It's not really useful. I say it's sort of like the appendix of the foot. It's there. It kind of separates the soft tissues superficially from other good things, tendons and ligaments underneath the plantar fascia. A flatter foot type predisposes someone to this condition. Sometimes this can be traumatic, but usually, again, it's a result of overuse. And pulling of the plantar fascia on that heel can cause inflammation. Now, we've all heard of the dreaded heel spur, if you will. This is a radiographic clue as to what's going on. That pulling on the heel causes that spur to grow. Now, I don't have any visuals of this, but plantar fascia heel spurs grow in line with the plantar fascia, never grow down. If they did, a weight-bearing surface of the heel, that certainly would be a problem, and I'd be doing a lot of surgery removing just that heel spur, but they don't. So it's a radiographic clue as to what's going on. Baseball fans may know Joe DiMaggio suffered from this, and he actually had surgery, which sometimes is indicated. But what happened, unfortunately, he wound up with a painful scar, which really was quite harmful to his career. Now, that was a complication, but we've learned a lot. And for this sort of surgery, the ligament can be released, but a lot of times correcting something called a tight heel cord, an Achilles, something called equinus. That's something that can correct this. So that overuse, that lever arm is changed. So anyway, that's some things about plantar fasciitis. There is an anatomical pictorial there. Okay, so again, focusing on breaking the cycle of inflammation, anti-inflammatories. This is an area we inject a lot, and we certainly can. There's limits, and there's certain things we need to consider for repeated steroid injections in this area, but something that we do a lot. Stretching, modalities, and I'll reference that really briefly in surgery. So physical therapy, a modality, something called iontophoresis, in which we utilize steroid gel to get into that inflammation, utilize ultrasound. There's something called extracorporeal shockwave therapy. To breaking up kidney stones with this technology, we can use this to treat tendinitis, in particular plantar fasciitis, and also surgery, as referenced just a little bit ago, releasing the plantar fascia or correcting biomechanics. If people have a tight Achilles, that can be corrected to solve this problem. This shows that extracorporeal shockwave therapy is OrthoNeuro. This is a procedure that requires no anesthesia other than local. It's a non-invasive, excellent option. Okay, so that's some things that are very common that we see, both no doubt medical problems as well as some unsightly things. So as we're preparing for vacation, as we're getting ready to take that trip, we certainly don't want our feet to get wet. So a few foot care tips and pearls: common sense hygiene of the foot, taking care of the foot and our toenails, controlling excessive perspiration with topical medications, appropriate socks. Again, shoe and sock health is a whole topic in itself that needs to be. Can't stress enough the importance of well-made, properly fitting shoes. If you have health problems that affect your feet more than other folks, if you're diabetic, if you're a little bit older, if you have circulatory issues, looking at your feet at least a couple of times a week daily is certainly helpful. Protecting our feet in public places. Again, a gym shower floor, it's a good idea to maybe consider shower shoes. Not that we have to be completely fixated on this. Public pools, there's chlorine there, and beaches, so an immune system, but just a little bit of extra caution where there tends to be a lot of feet walking around in the same place. Use a little bit of extra caution. Shoe and sock health, as we talked about, not only foot health. Pedicure awareness of you're one that goes to pedicures. Just be aware if someplace doesn't look appropriate. There might be a reason it's not, it might not seem clean to you. Keep in mind too that these places have to, it's their livelihoods. They have to answer to the Board of Cosmetology and Board of Health, and certainly promptly addressing foot problems before they get out of control. Okay, shoe tips, again, a topic in and of itself, but match your shoes with your activity. Know your foot type, getting measured regularly. A flatter foot type fits a shoe differently than a higher arch foot. For athletic shoes, strongly consider shopping at a specialty athletic store, an athletic shoe store. Big box stores are fine, but specialty places certainly tend to have that notch above when we're looking at specialty shoes for specialty activities and replacing the shoes when they are worn. So anyway, what I believe is our feet are certainly the foundation for healthy living, and keeping them healthy keeps us moving along our journey in life. So I appreciate everyone's time tonight. Hopefully that gave you a few things to think about, and how we take care of people's feet here at OrthoNeuro. We might have some time for some questions, and I'm certainly happy to answer them.
All righty. So we got a few questions. We'll go ahead and start with one of our first. How expensive is the laser treatment?
That is an excellent question. It depends how many toes are involved. I will say that it's not a one-time procedure, okay? As we talked about earlier, that toenail grows 1 millimeter or 2 a month. So it takes some time for us to see results, okay? We also don't necessarily have to treat all the toenails. So if someone has only a couple, that of course is a different scenario versus all 10 toes. So at OrthoNeuro, with our program and our laser that we have, a very advanced piece of medical equipment, we do treatments once a month for 6 months. And that helps. It helps because it's a little bit uncomfortable, and treatment duration is less, so we just spread it out more. So as a price point to discuss, it's certainly important to note. This technique is not covered by insurance, unfortunately. Now, we're a little disheartened by that because it truly is a medical problem. We've tried to work hard to get this covered. In very, very rare cases, it can be, but a lot of times people have a significant underlying condition. So probably about 99% of the time it's not covered. So to answer your question, it ranges anywhere from $150 to $850, depending on how many toes we treat.
Okay. And then do any over-the-counter meds work for athlete's foot?
Mm-hmm. So a good starting point would be an over-the-counter athlete's foot cream. So a simple recommendation I have, you can go to your local drugstore or pharmacy, Giant Eagle, Walgreens, et cetera, and you can ask the pharmacist their house brand of antifungal. Now, I'll give you a trade name, something called Lamisil. These come in generic form, and house brand things that can save you some money. So treating fungal infections in the skin are a lot easier to manage than toenail fungus. And typically, they respond easier with a shorter course than toenail fungus, especially toenail fungus that's been around a long time. So to answer the question, there are over-the-counter creams that can be effective, sprays, etc., for athlete's foot.
Can you share any stretches or exercises that might prevent tendinitis?
Mm-hmm. When we talk about plantar fasciitis, that's related a lot of times to not only that plantar fascia being tight, but the Achilles being tight. So runner stretches, okay, are very important to do. Our Achilles tendon, as I spoke to earlier, is the strongest tendon in the body. So when that is tight, okay, or overused, it can certainly be prone to damage and inflammation. So runner stretches. Without demonstrating, think about keeping your heel down on the ground and leaning into the wall and having the opposite foot closer to the wall. And you could switch, hold those positions for maybe 5 to 8 seconds. That's a simple stretch for the Achilles. Another stretch you can do, everybody seems to have an aunt or cousin that has a TheraBand, one of those stretchy rubber bands, or even a bath towel. You put it behind the ball of the foot and bring your toes to your nose per se and hold that for maybe 5 to 8 seconds. Do that 10 to 15 times daily, okay? Those are a couple easy things that you can do to stretch that very important Achilles tendon.
And how do you know when your shoes are worn and need to be replaced?
Very good question. So a lot of times, all right, with runners in particular, 400 miles or so, give or take, which equates to every 4 to 6 months if you're really hitting that shoe hard, and maybe a little bit more regarding mileage. The heel counter, which is the part of the heel on the well, essentially the heel itself, so the lateral portion of the heel on the side, if that gets worn down, that's certainly a telltale sign if they're just not fitting right, if they feel too loose or if they're getting abnormal pressure points, if you will. Now, you can do things. There's what we call heel plates to put on like a men's dress shoe to prevent heel wear. If we're talking about not doing that, it's really the heel itself getting worn down, the feel of the shoe being too loose, and obviously if you have holes anywhere, that's obviously a telltale sign that it's time to get new shoes.
Alrighty. How often should you get a pedicure?
Kind of up to you as the person getting the pedicure. Toenails that tend to be too long can be just as bad as toenails that are too short. So it depends on your growth pattern of your toenails or fingernails for that matter for getting a manicure. It depends also on what the goal is. If you're looking at cosmetic things for the ladies that get their toenails painted, this could be as often as every couple weeks to maybe once a month, depending. Now, pedicures in the aesthetic environment involve smoothing out those thickened skin pads, calluses, and corns that we referenced earlier, and addressing dry skin. The insurances pay for a medical grade pedicure every 2 months or so. It's actually 62 days, which is an interesting time frame, but that's when they pay for that, which certainly might not seem often enough, and we kind of feel that way too. I have a few patients that come in every other month, and they have a small fee to have this medical grade pedicure done, and we bill insurance every other time. So it's really up to comfort level of the person getting the pedicure if you don't want your toenails too long, as well as cosmetic factors.
Okay. I am 51 and my toes are in pretty good shape, but do have some lines up and down the toes. Is this an issue?
So the nail sometimes can be a window into other healthcare conditions. So we say those are nail ridges, okay? Sometimes it's a metabolic thing. Sometimes it's a history of a minor trauma to a toenail or fingernail. A lot of times these are benign changes. Sometimes, again, they can be related to metabolic conditions. So depending on how diffuse this is, depending on the growth pattern, etc., something to investigate, but a lot of times this is a fairly benign condition. And this is something a family doctor, a podiatrist, a dermatologist can certainly help sort out.
Alrighty. And then someone said, I never knew how to cut my toenails straight across. How does that help?
So if you round your toenail excessively, okay, we're talking about excessively, that can cause that side that's rounded excessively to grow into the skin. That's what we call the nail fold. Now, not to be sort of black and white about the whole thing, you can round your toenails slightly and follow kind of the contour of the toenail or the toe itself, the distal pulp of that skin on the end. But excessive rounding can cause that nail to grow in. So we tend to favor trimming them more straight across than not. So hopefully that helps explain that practice a little bit easier. You can round them a little bit, just excessive rounding can cause that side of the toenail to plow into that side of the skin.
Alrighty. Are there any more questions? All right. Well, thank you to everyone for participating in tonight's webinar. Our webinar will be our next webinar will be on June 2nd at 7 p.m. Dr. Mark White, neurosurgeon, will be speaking on treatment options for neck pain. Look at our social media pages for any additional information. Thank you, Dr. Napolitano, for presenting, and thank you to everyone for attending, and good night.
Thank you, everyone. Be well.
Right. Bye-bye.